Hi, I'm Gary Bebow, CEO of WRHS Health System, and this is our April CEO Connections. Last December, when we had our employee forums, I asked staff members for topics that were of interest to them and things that they'd like to see us address in the future. One of the common comments that were made included about what is our hiring practices at White River Health System, making sure that we hire the very best employees and that they represent the standards that we think are really important for us here at the health system. So with me today I have Gary McDonald, who's our Chief Support Services Officer. Prior to this new title that Gary received about a year ago, he was really in charge of our human resources. There's no one more capable than Gary to discuss the way that we recruit and retain the very best talent available in this area of Arkansas. So, Gary, why don't you talk to us a little bit about, well, first of all, talk a little bit about your background and how long you been here at the hospital?
I've been at White River now for just over 9 years. Came here from Eastman and had been with Eastman a little over 30 years, both in Kingsport, Tennessee, and then here in Batesville as well.
You're at Newport.
Originally from Newport, and still have family in the Newport area.
Yeah. And Tommy, and got grandchildren I know around this area, so you probably know a lot of people in this area.
Well, we've been here since 1977 when we moved back to Batesville, so it's home.
I know that something's really important to you is that we have the very best staff we can here at the hospital. So why don't you talk to us a little bit about the process that Human Resources goes through in identifying and then selecting those that we want to have on our staff.
Sure, be glad to do that. And I may back up a little bit. You talked about retention in your first question, and I may just talk a little bit about turnover because that's one of our measures on our report card, and I'm sure people have seen that we're not exactly achieving our goals right now. We saw an uptick in turnover that started about mid-year of last year, and that trend has continued for at least up until this point. Historically, we've run about 18 or 19% turnover here at the hospital. We're currently running about 21%. Our peers are running in the 18 to 20% range, and so our goal is 17. That's sort of an ambitious goal, maybe, but we've achieved 17% before, and so we think that's an achievable goal. And February has been a good month. We're a little under about 16 for February, but we're not meeting our goal, and so we know we've had an upward tick in it, and we've been trying to analyze why are we losing folks. Mm-hmm. So we spent the last several months just simply doing a better job of capturing why are people leaving us, and there's really two categories of reasons. There's what I call a primary category, and there's four parts of that. One, people are leaving us because they're relocating out of the area, either following a spouse to a job at another location or moving closer to grandkids or children or whatever it is they want to do. One is pay. They're leaving us to go to a job with a higher pay scale. A third one is simply work schedule. There's some dissatisfaction with work schedule. And then the fourth area that's in what I call the primary component is what we call personal or family reasons. People are leaving employment. They're really leaving the job market because they may have a sick relative that they need to take care of, or they've had a recent baby and they want to stay home and take care of the child, but they're leaving us and they're actually leaving the job market. If you look at those four reasons, that's about 50% of why people are leaving us voluntarily. There's another group of reasons that we're seeing that are what I call secondary reasons. Those would include things like health reasons. People have a health condition that just does not allow them to continue to work or at least do the job that they're doing here. They leave us to return to school and further their education, maybe toward an RN degree or something like that. Some are leaving due to a career change. They've come on board with us and they found that healthcare is just not what they really would like to do. Or maybe they've got a career advancement. Maybe they're a staff nurse here and they are able to take a management opportunity at another location. Relationship with supervisor is one of those secondary reasons. Dissatisfaction with commute. People are driving distances and they can do that for a period of time, and then it kind of wears on folks, and I can understand that. And the last secondary reason is simply maybe dissatisfaction or frustration that they didn't have sufficient training or orientation before they were put on their job, and so they feel stressed out that they're not able to do their job in the way they want to. So those 7 reasons represent another 40% of why people leave. So if you took the 4 on the primary and the 7 on the secondary, that's about 90% of why we're seeing people leave us at the present time. To address that, we've done a couple of things. One, we've tried to collect that data through what we do, an exit interview and a follow-up process. We've tried to get that information in the hands of managers so that they can begin to put action plans in place to address things that are specific to their area, whether it be improved training and orientation programs, improve interview process that they may be using internally, or whatever the situation might be. We've tried to get it in their hands. Certainly we recognize that pay was one of those, and we did try to make some pay adjustments, as you recall, back in January, and hopefully those will help. I would say with our pay policy, which is to be competitive with our peers, we're probably never going to be the highest paying entity, probably never going to be the lowest paying entity, so we try to be competitive, but there'll always be a chance to go somewhere else for a little more money. I would hope that folks will look at our benefit plan when they start talking about pay and realize that there's some attractive features to our benefit plan as well. But in addition to getting information in the hands of managers, we've tried to start something that I would call our stay type interviews. I mean, an exit interview is an after the fact. It's after you lose somebody and you find out why they left you. We're trying to get something incorporated that's more proactive, more preventive, and encouraging managers to sit down with employees before there's ever any indication that somebody might be dissatisfied and say, I really want you to stay here long term with us. You're a great part of our organization. What is it that you enjoy about your job? What is it you'd like to do in terms of further training or further assignments, and to help them develop a successful path in staying with us. We've started those in our 30-day interview process and our 90-day interview processes, and hope that we will expand that, again, a more proactive, preventive loss rather than a reactive to folks leaving us. Now, that was a long answer to get you back to your question about interview process, I think, and if I were to describe that to you, I would say the first thing we try to impress upon folks is that an interview really has 2 primary objectives. One is to be sure we try to find the right fit for us. And the second is to try to be sure that that applicant believes that we're the right fit for them. Because clearly we want the best person, but getting the best person when we're not the right fit ultimately is going to lead to turnover, and that's probably not a win-win situation for us. So we try to impress that on the folks that are participating in the interview process. Different departments have different ways of doing things. I think here's some commonalities, and if I could say that it starts with a funnel, and I would use this approach. And at the top of the funnel, you have a number of different applicants, and HR is kind of involved at the top of the funnel. We will do a paper screen of applicants that are applying for a certain position, and when I say paper screen, we'll look at their application, their resume, we'll review their work history, what their stated job interests are, those sorts of things, and we'll try to determine best we can, do they really fit the job that they've expressed interest in, or is there something in that work history that probably doesn't make them the better candidates compared to other folks. From the paper screen, then we'll filter some candidates down to what I call the next level in sort of the face-to-face screening process. And the nursing organization has a good process that they're using that they've started in the last year or so. They have a team of director-level type folks that comes over, I think, once a week to the HR group. They sit down with the nursing candidates that have made it through the first step in the process, nursing being LPN and RN. And they do an interview with those folks, typically 20, 25, 30 minutes, something like that. again, trying to find out, is that a really good candidate for the organization based on the job at hand, the candidate's experience, their stated job interest, that sort of thing. And secondly, assuming that they are a good candidate for us, where's the best fit in the nursing organization? Is this particular applicant a better fit for maternity or med-surg or ER or some other unit? And assuming that candidate, passes that screen, then that group of folks simply directs that candidate on to what I call a peer interview type thing in a specific department or maybe departments. You may have a candidate that the nursing directors feel like's a good fit in med-surg, and so we'll send them there because of the candidate's interest. The candidate may have said, I'm also interested in maternity, and so they may line up interviews both places. Med-surg would have a peer team to do some interviews. Maternity would do a peer team. Sometimes they're competing for the same applicant. But that's kind of the flow, and you can kind of see from hopefully a large number of applicants down to what is what we hope is a selected applicant. That last step, when you have that peer team interview, that's a crucial piece, because at that point you got people that are pretty close to the job. And not only do we want those folks to evaluate, is that the best applicant that fits us, but they're in the best position to give that applicant a good understanding of what it's like to work at White River. And that's
also,
where
they kind of take ownership in their success too, don't they?
Well, that's what we would hope they would do,
Sure.
is to take ownership, because ultimately they're the ones that are going to be working side by side with that person going forward. So that, in a nutshell, is kind of what the process is. Everybody does it a little bit differently, but that's sort of a pretty good conceptual of how most folks do the interview process here.
I think it's really important to remember we have some really good long-term employees here that worked really most of their lives in many cases, and come in April we're going to have another employee recognition dinner.
Right, service award dinner.
Yep, and so we'll get an opportunity then to recognize those that have 5 years and then increments of 5 years tenure. I go to those every 6 months when we have them, and I'm always so impressed with the quality of the people that have come and just how enthusiastic and devoted to the institution. I know you feel that same way.
Well, I do, and I would say, well, you asked me how long I'd been here. I've learned many things since I've been here, and one of the things that I think I've learned and certainly have grown to appreciate is that not everybody is cut out to work in healthcare. It really takes a special person, and that's why it's important that I say it's got to be a fit for us, and we have to be a fit for them. Because clearly there are times when the hours are long, and clearly there are times when the work is hard, and sometimes the tasks that we ask folks to do, particularly in the clinical area, are sort of messy. They're not the cleanest tasks that we would like to necessarily do, and so it just takes a special person, I think, to have that compassion in their heart that they're going to work in healthcare long term.
I was having lunch today with Jordan Strecker. He's the nurse manager up on the 3rd floor, and we talked about staffing on his unit and so on, and we both agreed that at White River Medical Center it's a great opportunity to come at a base level, like in the patient care tech, and then having experienced some here taking care of patients. So many people decide that by way of that entry level that nursing is their career, and so here at the hospital we not only provide that entry level but also provide assistance for them in education and training, with the intent that they would sometime get more nursing experience and eventually hit into that career, those higher career objectives. And so, not every organization has that capability within their own organization to have that entry, but yet that upward mobility available to them.
True, and I think that's a good point, and certainly, the folks that are watching this broadcast, if I were to ask things of them, I would say if you've got good friends and others that you want to recommend for what I think can be a rewarding career, I would hope that we'd encourage them to consider White River, because as you say, we can take somebody at an entry level, we can provide scholarship and educational assistance to let them get their degree and in the long term have a very rewarding career with us.
Yep. But Gary, I really appreciate you coming today, you've done a great job for us as the head of our HR over the years, and really appreciate all that hard work you've
We
made.
appreciate it.
Thank you.
Mm-hmm.
Each month I have the opportunity to recognize employees of the month at Stone County Medical Center and White River Medical Center. And for the month of April, we have Mandy Van Dyke, who's an RN at Stone County Medical Center, that has been chosen. Mandy's been with us for about 2 years, and based upon all the feedback I got, she's really well deserving of this recognition. At White River Medical Center, Kayla Ward from our wound care clinic has been recognized for environmental focus. Oftentimes I see Kayla going up around through the hospital, and I can tell you that she's really an excellent employee, and again, really well deserved of the recognition. We have 2 new providers who started with us in March. First one is Jody Gibson, who is an APRN who works at our Stone County Primary Care Clinic. Jody has 18 years of experience in the nursing profession, the last 6 of which has been as a nursing practitioner. Jody will be working in the clinic that Dr. Nick Pitascalzi practiced in for many years, and so up until Dr. Perot, who will join us in July, Jody will really be helpful in keeping that practice intact, waiting for Dr. Perot to join us. Another provider, Aaron Sandifer, an APRN, will join Dr. DePonio at the White River Medical Center Family Practice Clinic on White Drive. So please welcome both Jody and Aaron to be a part of our provider staff when you see them. Each month, White River Medical Center hosts a community education event, and on April 12th at noon at the conference center, I'm really pleased to report that Dr. Mark Wright will make a presentation on circulation and peripheral vascular disease. Dr. Wright began working at White River Medical Center on March 21st, and all of us really look forward to him being a part of the staff. He brings a specialty that we haven't had previously at the hospital, and I know he'll really provide great services to this part of Arkansas. Previously, you heard from Gary McDonald about our hiring practices, assuring that we get the very best quality talent that we can to come work with us here at White River Medical Center. That came out of the employee forum, as I mentioned, and some other comments that were at the forum that I want to address in future CEO Connections is one is the financial side of the hospital and how we're doing, making sure that we remain viable for our future. And the other one is our quality at White River Health System, and how we're doing in quality and what we're doing to improve quality here. So that one, in the quality area, we'll have Gary Paxson join me, and in the area of finance, we'll have Phil Hacker, who is our Chief Financial Officer, join me. So look forward to those sometime in the future. Next month, I think we're planning on having Dr. Jason Knott be a part of the CEO Connection. Dr. Knott joined us last November as an OB/GYN, and I'm really looking forward to hearing how Dr. Knott's practice is going and some of his insights in the OB/GYN services here in the system. So look forward to that next month. As always, if you have any suggestions on how we can improve this CEO Connection or any other things at the hospital that we can do better, be sure to let us know. Thanks a lot, and we'll see you next month.